A hearty good morning and welcome to the webinar. Today is the preview of the 2022 open enrollment. If memory serves me, this is the 9th open enrollment that's taking place. So 9 of these babies that we kick off today. So of course it starts on November 1st, but before I do that, let's go through some housekeeping. And here's my information. I'm the lead account advisor. Eric is a broker specialist. Between us, we have 20 years of experience. Take a moment, jot down our phone numbers, email addresses, everything and anything to do with the individual market. We can help you. And some more housekeeping questions, put them in the question tab, and we'll get to them at the end of the presentation. If you're having difficulty with sound or any kind of technical issue, also post that in the question box, and we're going to be monitoring this as we go along. Another public service announcement. I want to highlight the agency services program at Cornerstone, because as a Cornerstone broker, you have access to a myriad of services that can help you with your business outside your scope and planning for the future. The ASP is designed to help you plan for your business, your clients, and your family, no matter the situation. A lot of inquiries about this lately. So absolutely take a look at this, take a close look at this. Among the services provided in the ASP are the Autopilot Client Referral Program. We help you out. We enable you to just focus on stuff that you want to focus on, and we can help you out. And in addition to this is the parachute succession planning, the flight plan retirement assistance, and the co-pilot service agreements. And as an ASP broker, you're the pilot of your business and we create your flight crew. And it's customized plan based on your specific needs to ensure that you, your business, and your family are covered. Check it out on our website. Here's the screen. It's on our website. Jess does a fantastic job with our website, updating it constantly. So please go out to our website and check it out. Okay, just a quick shout out for our incentive program. Let me move this screen real quick. Earn up to $7,000 with the cash incentive program for all your group and individual business between January 1st of 2021 and December 31st of 2021. So we're still in it. So this is accruing towards your cash incentive program for the bonus program. And there are the details. Top qualifier gets $7,000, second place $5,000. And we're tailing these up as we go. And stay tuned for the 2022 program. This will be coming out in the next couple of weeks, and it'll be in a similar vein. So keep at it, and that's the incentive program. You can also check it out on our website. Okay, let's kick it off with the 2022 open enrollment. First and foremost, FFM certification, believe it or not, just went live a couple weeks ago with the federal government. So a lot of folks are still scurrying and getting that done for the new agents. Now, returning agents, it's really super easy, and I can attest to it. It takes no more than 2 minutes for returning agents. But there's the website for that. And by all means, if you have any questions about it, give me a call. I think our focus now would be on the new users to get started. And be sure to remember to use your username and password. It was the one you used year in and year out for your refresher. Passwords need to be reset every 90 days. And once your training is complete, you verify it on the website there. And I do want to point out, I failed to mention this, in the state of Kentucky, they have instituted their own state-based marketplace, and it is similar to the FFM, but of course it's got a twist to it. It has its own certification, and they have basically throttled that down, but I think you can still get certified on that. We had a bunch of info on that earlier and a bunch of emails and notifications on that in September. I think most everybody who was going to do it got it done, but if you need any help on Connect and it's still a work in progress, give me a call. Their website is still being built out, their enrollment platform. We're still struggling with it, but hopefully it'll be up and running by the end of this week, and you'll be able to go out there and quote new programs for your clients in Kentucky. Call me if you have any questions, by all means, or call Eric. Help on Demand is a real-time consumer assistance referral program operated by the Big Wave systems that connects consumers seeking assistance with state licensed agents and brokers in their area who can provide immediate assistance with marketplace plans and enrollments. Only agents and brokers who have completed the marketplace training and registration are eligible to participate in Help on Demand. And agents can access more information on Help on Demand by following the link down here on the screen. Okay, essentially, I like to think of it as a jump ball. It's a referral program where the process is initiated by the client. He goes out on, healthcare.gov. He needs assistance. He pushes a button, and it's like a jump ball, thrown up in the air, and the first person to react gets that lead. And it's geographic, so it's not going to go throughout the state. It's going to go, in your city. So it's a great little tool, and folks have really enjoyed it. They've been able to get not only ACA leads on it, but future Medicare leads on it. So I know this is a dual effort, ACA, and it dovetails in nicely with Medicare, which is taking place right now. And I'm going to switch gears for a moment and bring in my colleague, Eric Pouncy Jr., and he's going to talk about the Health Sherpa enrollment platform.
Alrighty, good morning. Next up, we have the Health Sherpa ACA enrollment platform. Go to that next slide, Geoff.
I'm going to bring Eric over a little bit so you can see it.
There we go. So all about Health Sherpa. It's an innovative healthcare technology. It's one of the largest in the country for ACA markets. It's approved by CMS to offer the enhanced direct enrollment. And then here are the benefits. There's no redirect to healthcare.gov as in the past. If you used other platforms, you have to go redirect yourself. There's no more waiting rooms. You can shop on one site, do all your drug and provider searches there, upload any documents for your clients, and it's something that they have their support is there year-round. And usually anytime you need help, they do a really good job of assisting. You can track your clients' activities, whether you send your quoting link to them and they can just enroll themselves if they're that tech savvy. They also do a good job of reporting and having analytics there for you, along with their animated renewals. And it's free. No cost. All you have to do is go to the link that we have listed there, fill out your Health Sherpa. It's like a little form of your information, and then we just go ahead and we get your account set up, and then you're off and running. And we'll go back to Geoff and talk about ARPA.
Great camera work. You can tell I was NFL cameraman. That was not the greatest camera. Great job, Eric. Fantastic. Health Sherpa, everybody, check it out. It is the cutting edge of enrollment, and they have a bunch of new features this year. So give us a call. I can walk you through it. Let's talk about the American Rescue Plan, which had a massive impact on the health insurance landscape this year. Now, the Affordable Care Act's been around for 8 years. In the past 4, there's been fewer and fewer people enrolling. Now, this all changed in September. They boosted the subsidies. I'm going to wing right through this, but the idea was they'd add 2.5 million people during the off season, during the spring and summer, outside of open enrollment. Well, in fact, they added 2.8 million. So that's pretty impressive. So it's all about improving affordability, and the ARP or ARPA lowers premiums who currently have marketplace plans and expands access to financial assistance for more consumers. And I'm going to wing through this again. So in April, consumers enrolled in the marketplace coverage, they took advantage of increased savings and lower costs. On average, premiums decreased by $50 per person. Anecdotally, I think it was a lot more, like maybe a couple $100. 4 out of 5 enrollees can find a plan for $10 or less after the premium tax credits, and more than 50% find silver plans for less than $10. Okay, based on the FPL, okay, that's, it's a big math problem. If anybody's done a FFM application or done the certification, there's a table that creates the subsidy. Okay, it's based on the federal poverty level and where you fit in that situation. And these are the current 2021 FPLs. In 2022, they'll be about the same, and I'll have that information for you very shortly. So in the old law, no one paid more than 8.5% of their income for the benchmark silver plan. I'm sorry, in the new plan, no one will pay more than 8.5% of their income for the benchmark silver plan, and that means there's no subsidy cliff. Okay, in the past, people that made above 400%, they got no subsidy help. But with the ARP, it's based on 8.5%. And to reiterate, no one will pay more than 8.5% of their income for the benchmark silver plan. Okay. And to illustrate this, here is a screen that indicates the old versus the new. The old situation was this: folks, again, who made just above that threshold, a lot of middle income people, they saw their premium go way up. Okay, they saw the premium go way up here. And with the new program, it has smoothed it out. No one pays more than 8.5% of their income. So here is a better illustration of what I'm trying to explain here. So in the current situation in Ohio Mail, again, from 2020, their premium was $328, and then under the new plan, it went to $211, which reduced it by 36%. Okay. Kentucky, someone was paying $415 starting in April of 2021. It went down to $299, and the reduction was 2.8%. And even more dramatic for someone age 60 and at a certain income level, like 105,000, they saw their income, their premium go from over $2,000 down to $751. We saw a lot of this, and so they saw a 64% reduction. And I'm sure a lot of you have witnessed this already, because this is what we've been harping on for the last few months, to go out and have these recalculated for your clients. Here are the states that it impacted the most. Certainly Ohio was a big one, but the darker blue, even more dramatic. West Virginia was huge reduction. Kentucky, a huge reduction. So by all means, reconcile your income for your clients so they're taking advantage of these new subsidies if you haven't done it already. And these are retroactive to January 1st. Okay. Okay. So, and if you didn't do anything, don't worry, they'll still be able to enjoy these savings at tax time. You'll be able to claw that back at tax time. Any questions about this, just let me know. The big question we get about this, the ARPA, will off-exchange clients be able to get these new subsidies? No, they need to apply on the FFM to get these. So, fix my camera a little bit. All right, hopefully that's better. Okay. Okay, now I want to switch gears about something that is relatively new and unfamiliar to a lot of agents, but really important. We focus on this. It's called OPERS, which means Ohio Public Employee Retirement System. And this is a great opportunity for 2022. So in a nutshell, these are pre-Medicare retirees. That's who we're focused on. These are pre-Medicare retirees. So folks that retired from their state job, their county job, their public employer job, and they retired when they're 50, 55 or something like that. And you know, they used to get a group plan administered by the state of Ohio. And they're gonna receive an allowance, okay? And you know, previously the health plan was administered by MedMutual, so that's going away. But now they're gonna get an allowance. So in a nutshell, on December 31st of 2021, OPERS will no longer offer the pre-Medicare group plan. Instead, on January 1st, eligible pre-Medicare retirees will begin receiving a monthly health reimbursement arrangement. Okay, and that's lovingly known as an ICRA. This is an allowance. They're going to get money, okay, as opposed to the group health plan. And in addition to receiving a monthly health allowance, you'll no longer pay a medical premium through OPERS. That's that medical mutual plan. And your monthly benefit amount will increase by the amount you currently deducted for that premium. Okay. The most important takeaway from this is read this website. Go to this website, learn about it, how this will impact Ohio public employees. And I want to mention this as a great referral opportunity because it's a fantastic market, a very, you know, as we say, sticky market, great referral opportunities, a lot of retention with these clients. And what's more, they're in the Medicare zone. So they're prepping for T65, and I know a lot of folks out there do that too. So that's a fantastic opportunity. OPERS, Ohio Public Employee Retirement System, and learn about it. You can sell them ACA plans. I know the stipend is handled by a third party, but you can sell them ACA plans and the like. So take advantage of that. And by all means, if you have any questions about that today, let me know. Okay, we've got several questions. Okay, hopefully everybody's sound is much better. Okay, so, all right. Okay, I'll turn it up a little bit. Okay, now to the heart of the matter. Let's talk about the current ACA carrier market footprints for 2022. So we're going to go through our markets for the ACA. And in 2022, Ambetter has expanded their footprint to about 70% of the counties, and they include all the metro areas. And as of today, I don't have the hospital networks, but I can share with you what they have now and what in all likelihood they'll have in the future. So in Cincinnati, they use the Tri-Health and Christ system. So Tri-Health, you know, you think of Good Sam in the Bethesda Hospital. That system very popular, so Ambetter uses them. And they also have the Christ Hospital and maybe a few more. I think they have some Mercy as well. So they do a good job down here in Cincinnati. In Dayton, they're using Kettering. And Columbus, they use Ohio State. In Toledo, it's the Mercy and ProMed system, ProMedica. And in Cleveland, it's Lake, Metro, and some others. But this is all subject to change. And as of yet, I have not seen the new provider listings. And they're out on their website when they post them this upcoming week. And they'll also be on Health Sherpa. Okay, that'll be updated there. And I want to emphasize to everyone that they do a quick provider search when they enroll clients and print off the provider search screen and date it and put it in their database so you are covered at the, in the future to point out that you shared accurate information at the time. Okay, and we all do this sort of thing anyway. So new to Kentucky is Ambetter. So Kentucky obviously has some additions this year. I want to talk about those briefly. Ambetter is one of those. They're going to be in the three metro areas, Louisville, Lexington, and Northern Kentucky. And in Northern Kentucky, they're going to be using the St. E's network. Okay, much to our chagrin, this will be on the Connect system, which is still being built out. It should be ready by the end of the week, but the enrollment platform is there, but I'm not able to run rates yet on it, but we're working on that, or they're working on that. And keep your eye out for this Connect program. Ask me any questions you have about that. Now let's talk about Anthem. Anthem is doing expansion as well. And they are in just about all the counties aside from about 7. And in Cincinnati, they do a great job with Christ, UC, and TriHealth. In Dayton, they have Kettering and Premier. Coverage in other parts of the state, not as rich maybe. They're very lean in Cleveland, I know, and I'm pretty lean up in the Northwest Ohio, traditionally. Again, that might change, and by all means consult provider listings for that. And I know in Columbus they use the Mount Carmel system. Of course, Anthem has always been in Kentucky, and this is their footprint. I think they're a stronger player in Northern Kentucky than any other part of Kentucky. In Louisville, it's only the U of L network, but up in the Northern Kentucky area here, it's the St. E's network. Okay. And I know everybody's asking about commissions. We'll get to that in a little bit, but that's Anthem. And then next is Oscar. And nothing really has changed. They added a few counties here and there. They added Tuscarawas, but Oscar, if you're unfamiliar with that, is a new player in health insurance, and their strategy is to partner with one health system in a specific metro area, very targeted, and they don't try to go for all the business in the whole state. They just target in one metro area or 2 metro areas in a given state. In this case, they have the Cleveland area, and that is exclusively the Cleveland Clinic. Okay, that's the only provider they have in the Northeast Ohio, Cleveland area. And in Central Ohio, it's a partnership with Mount Carmel. New to this year is people in Columbus can access the Cleveland Clinic if they want. So they can make the drive up to Cleveland and use Cleveland Clinic up there. Okay. And Molina doing a lot of market expansion this year, and I think they're going to be very competitive with pricing. I've seen you know, their rates are basically the cheapest, if not second cheapest in most areas. They're very aggressive pricing this year. And in Cincinnati, they use the Mercy and UC system. In Dayton, they use the Kettering system. Toledo, it's the Mercy system. Columbus, it's OSU. Cleveland, Lake, and Metro. And I want to reiterate, always consult the provider listings because these change periodically, but that's the general footprint for Ohio. And as I alluded to earlier, Kentucky, Molina is in Kentucky as well. So they moved into Kentucky. They moved into Louisville, the Louisville area. And it's just 3 counties. I don't think this will be a big impact on our brokers. We have a few brokers down in Louisville, and we do have a presence down in the Louisville and Kentucky area, but I believe most of the people on the call today are from Ohio. Nevertheless, it's a good opportunity. 3 counties here. This is the Louisville metro area. They're going to be using Norton and the University of Louisville. CareSource, they've been around, and in Cincinnati, they have most of the major hospitals. I think their biggest strength is down here in southwestern Ohio. The one thing they have that others don't is they have the Children's Hospital Network. So they have most major hospitals in Cincinnati, and Dayton, they have Kettering, and I'm going to get to that more. So I'll talk about comp in a moment. And they are in Kentucky. They are in Kentucky, as you can tell, in most areas in Kentucky. They're also in Indiana. There's the comp for Indiana. Okay. And before I go to dental plans, I just want to roll through. The comp hasn't been nailed down for these carriers, but this is what you can jot down for what I know in Ohio. So Anthem will be paying $16 per member per month in Ohio. So $16 per member per month for OEP. And that's limited, that's capped at 2 members, however. Now Anthem in Kentucky, they'll be paying $140 per member per month. Okay, there's no cap on that. So that's the Anthem OEP commission for 2022. CareSource in Ohio will be paying $20 per member per month. CareSource in Indiana is $19 per member per month. Unfortunately, I don't have the figure for Kentucky, but it should be very similar to what they paid last year. And the other figure that I have is for Molina, and that's going to be $15 per member per month. Again, Molina is going to be $15 per member per month. Okay. I am still waiting on Ambetter. Okay, I'm still waiting on their commission for 2022. Currently, it is $20 per member per month. I anticipate Ambetter to be the same this year, but unfortunately, I wasn't able to publish anything today. And by the same token, Oscar has not posted their commission for 2022. We anticipate it to be the same though, and that premium, I'm sorry, that commission is $18 per member per month. Okay, that's the commission, and by all means, if you have any more questions about that, just give me a call or send me an email. Dental plans, let's just roll into this and then we'll start wrapping up. Dental plans, a great addition to your clients, and again, remember, you want to sell these directly from the carrier. You don't want to use the FFM portal to sell dental. First, it's a very lean FFM platform. And secondly, you don't get commission when you sell it on the FFM. So go out to the carrier websites here, Anthem, Emeritus, Dental Care Plus, Delta Dental of Kentucky, and we also have Humana, but I just want to focus on these 4 here. So you know, Anthem has expanded their dental plans tremendously. They have like 3 or 4 different platforms of dental plans. And now they have the Dental Family Enhanced, which is a great program and has a lot of first dollar benefits. And they have a strong network. So they really focus on relying on a dental network, okay? And Emeritus also does a fantastic job. They have very competitive prices. They have a lot of first dollar benefits. They, however, have both a network plan and a non-network plan. So it's something to really embrace. Take a look at the Emeritus offerings. They go by Prime Star. Prime Star is the actual product name, and they do a great job. They pay great commission, and upwards of 25 to 30% for commission. Dental Care Plus has been one of our flagship plans over the years, and they're primarily in Southwest Ohio. They had some hiccups in the recent year with billing because of a recent merger, but that has been rectified, and they are off and running. They do a great job in Southwestern Ohio with their HMO, and it's been a partnership we've had for years and years. And they also offer a PPO statewide. Be happy to share more of that with you. Delta Dental of Kentucky is a new individual product that we're marketing, and we've been offering for the past 12 months or so, and they do a great job. Delta Dental has great brand recognition and a lot of features there, a lot of popularity with the Delta Dental, and Humana has been a steady dental partner over the years. I haven't seen too many enhancements over their original product, but they have a loyal client base, especially among veterans and others. So let's swing over to ACA Alternatives, and I'll be touching on Sidecar here in a minute. What I mean by ACA Alternatives, I mean FFM Alternatives. And let's talk about these, okay? So short-term, and the short-term markets, we have IHC, and they have changed some of their plans and maybe aren't getting the market share that they had in the past, but they're still one of our short-term offerings. Our tried and true short-term offerings, though, have been Golden Rule and National General over the years. And Golden Rule, also known as UH1, has a solid network. They're a little more conservative in underwriting. They have a wide range of options. In fact, they have over 140 plans. Some are like doorbuster teaser rates, but they're far and away the biggest short-term product. So UH1, Golden Rule, and they have a very comprehensive short-term offering. Now, these are these are going to be good offerings for folks that don't qualify for a subsidy. That's what we call them, alternatives. So folks who don't get a subsidy, they make too much money or find a need for it. These are the offerings. And let's talk about National General. It's the latest iteration of John Alden, or what we know as Assurant. They're very good. They use the Aetna network. They pay a little better compensation. Golden Rule pays about 18%. They pay more like 20% on commission, depending on the product. The other nice thing about National General is they offer preferred rates as opposed to just standard rates. So depending on the client's condition, they offer preferred rates. And okay. What's more, these plans also offer wrap plans, accident, critical illness plans that you can use to enhance the benefit and help them bridge the deductible. So all these short-term plans offer critical illness and accident. Now I want to switch gears. A new focus has been on Sidecar. You've been hearing a lot from us on Sidecar, and this is where I want to talk about it. I want to give them a lot of airplay here. This is a new off-exchange ACA offering. So this is something that's being offered November 1st, and it uses the transparent cost direct pay model. And on our website, we have ability for you to register for their trainings. They are going to be competing again in the off-exchange arena against the likes of Anthem and Oscar and some of the other carriers that offer the off-exchange ACA model. That means they are guaranteed issue. Okay, they're guaranteed issue. And the big takeaway with Sidecar is this new method of reimbursing providers. It is the transparent or direct pay model. In other words, you're going to ask for the cash price when you see the provider. And this is something that is on the forefront of healthcare now. In fact, there was a law passed January 1st of 2021 that mandates that every hospital show their cash price for every procedure that they list. As a result, anybody can go into any hospital and demand the cash price, and that hospital should honor that. So as you can imagine, a cash price is probably a lot less than what the insurance carriers are paying the hospitals. And one reason being is the cash price is paid immediately to the providers. As a result, they can lower their costs. By all means, check out one of these trainings that Amy and Stacy are doing at Sidecar. They're taking place weekly. They're taking place via webinar, and there's a link to these webinars in our webpage. And they pay great commission. They pay $30 per member per month. So really, really excited about Sidecar. I think this will be a really important program, a game changer. It's going to be a transformational and disruptive product going forward. And we're really excited to have that partnership with Sidecar. Okay, that's the transparent cost. Now, Altrua, they are the Christian Ministry Health Plan, and they're administered through Crown Administrators. Christian Ministry, if you're not aware of that, is a health sharing ministry. And how that works is these plans aren't technically insurance. They use a arrangement where members contribute to a health share pool, and this is what is used for claims. And with Altrua Health Share Ministry, they do some underwriting. So there is some background that needs to be addressed. For example, they don't take tobacco users, and there's other conditions. They mandate that you're in a traditional relationship, that you're in a traditional marriage relationship, and there's some other things to it that you'll learn about when you do the training. And that's something I can share with you and get you set up on as well. So that's the Altrua Health Share Ministry through Crown Administrators. And I'm just giving you a thumbnail sketch of all these, so you have more to go on as you roll through the insurance market. So let's switch gears to the Autopilot Referral Program. And this is a compensation-based referral program that we offer with our agents, the ARC Client Services Unit. And you can offer these services to quote, enroll, support, and provide year-round service to your clients who may fall off your business scope but never off your radar. check it out on our website. These are the states that the autopilot referral program markets to, and basically the I-75 corridor. We're not going to be doing much on the state-based exchange other than Kentucky. Check it out. ARC Benefit Solutions is our referral wing. ARC stands for Annie and Ryan Carroll. So it's all part of the Carroll family of companies. So they are a sister company to Cornerstone. And there's some more info about autopilot. Okay, it not only involves individual, but group as well. And we also do Medicare. You just select which products you want us to market to, and we'll take care of the rest. And we'll share in the commission. Okay, there we are again. Let's look at some questions. Okay, fantastic. Great. Thank you so much for participating. I hope the sound got fixed. And I think, okay. Somebody had a question about Oscar. Okay, Oscar. So what counties is Oscar in? Let me scroll back to that screen. And so here's the deck for Oscar. So Northeast Ohio, they have obviously the lake counties, but they also have some inland counties, namely Molina, Summit, and Portage counties. Not Molina, that's Medina, forgive me. Medina, Summit, and Portage. In addition to that, they have Wayne, Stark, and Tuscarawas. Okay. Next question, can you distribute a chart showing the hospitals anchoring the carriers in the market areas you discussed? We are creating that now. And again, I don't want to be premature and put out stuff from last year. We are gleaning this information from their websites right now. And I'll be sharing that with you. And there's going to be more information coming out in the coming weeks from us. Not only this, but compensation and bonus and the like. Next question, what's hospitals for Molina in CareSource in the Cleveland area? I know for a fact Molina has Lake and Metro. I know CareSource roughly covers that same footprint. CareSource will not have Cleveland Clinic. They will not have UH. Okay, so university hospitals and the Cleveland Clinic are handled elsewhere. And I didn't talk about MedMutual, but MedMutual, who uses a direct to broker format, they're going to be using United or university hospitals. Okay. Okay, so again, can you show CareSource Ohio again? I'll be happy to, Sherry. So let's go back to CareSource. Way down here. Okay, so CareSource has all the counties. Their hospital footprint in Northern Ohio isn't as rich as it is in Southern Ohio. So I think they're a bigger play in Southern Ohio, but they do have a pretty broad county network, and obviously they do pretty well in the rural areas, which isn't which is not a strong suit of some of the other carriers. Okay, a great question about sidecar. Okay. Yes, sidecar is guarantee issue. It is just like any other ACA plan. They handle pre-X, so they do handle pre-X on this sidecar guarantee issue product. And while I wasn't able to focus on it too much, I want to emphasize that you check out their training. Amy does a fantastic job with the training. She'll go into greater detail about how it works. Okay, again, it's a new reimbursement model. It's cutting edge, and we want everybody to check it out. Okay. Good question. How does Medical Mutual stack up with short-term? As I mentioned earlier, Medical Mutual is not one of my carriers. Nevertheless, you know, they do offer a short-term plan, and my recollection is that it's a little bit leaner. Doesn't have nearly as many plans. Might be a little more expensive. So they underwrite. I think they pretty much operate in a similar vein as far as underwriting and plans as someone like United Healthcare. Okay, and a good question. Are unemployment benefits included in income figure when calculating a subsidy? Yes and no. So there was an enhanced unemployment benefit this past year, and that was sunsetted at the end of September. But unemployment benefits, there is a treatment of unemployment benefits and how your subsidy is calculated. It will all bear itself out in the application process. They will specifically ask you about unemployment and what those figures are. So unemployment is something that is calculated in the whole process of subsidy. And I can share more details about that when we send out the information, the follow-up information here tomorrow and later on. So I wasn't able to answer your question succinctly, but I'll be certain to share more information with you when I put the information together for you guys tomorrow. Can you send a list of the hospitals for each carrier that's used in Ohio? Again, we are creating that list and getting it out to you. We'll have that out to you hopefully in the next week or so, and I should have that. So take a moment if you have any more questions, just please jot them in the chat box. I want to emphasize we're here to help. All these tools and resources are here at your disposal. Be sure to check out our website. All of our webinars are on our website. And if you need any help with Health Sherpa, give me a call. And I think with that, we'll conclude the presentation. Thank you, everybody. Thank you, everyone, for joining us today. Have a fantastic day. Thank you.